Good afternoon and happy Friday. Welcome to the COVID-19 Learning Community, hosted by the COVID-19 Command Center and powered by the Joint Information Center. Some housekeeping. By default, all participants will be muted to minimize distractions. For Q&A, please use the raise hand function at the bottom of your screen. When called on, please unmute your microphone to ask your question and remute your microphone when not speaking to minimize background noise. When speaking, please announce yourself and speak slowly. You can also enter your questions and comments into the chat panel. Please hold all questions and comments until after the presentation portion of the event. Today's meeting objectives is to review the current state of the San Francisco COVID-19 epidemic and local indicators of hospital capacity, disease situation, and disease control and current pop-up testing efforts. Also to describe current efforts to address food insecurity and to review efforts to prepare for a safe Halloween in San Francisco. Here's the agenda for today, and I welcome Jafria Morris, the Equity Officer of the COVID Command Center. Jafria, the floor is yours.
Hello, everyone. Good afternoon. I'm getting ready for the 3-day weekend. I'm so excited for today. I'm a big Halloween person, and I know so many of you all work with children and families to hear that presentation, as well as, our 6 areas that we cover with our DNAPs is the Bayview, Chinatown, Viz Valley, Western Addition, Potrero Hill, I don't want to miss a neighborhood, Lakeview, Excelsior, the Mission, are all areas that have some of our most vulnerable populations. So today is really centered on that, and those are also the locations that have the most children in San Francisco. So I'm super excited for today, and I hope that you all ask really good questions and get the information that you need to do your job better with community and understanding COVID-19 and how to safely trick or treat and also make sure that food is provided. Thank you again for coming out every Friday. Thanks. Go ahead, Dr. Fuchs.
Sure. Great. All right. I think we're going to be moving on to the next thing. And if there are additional questions and they come up, please put them in the chat. I'm happy to respond. Thanks so much.
Thanks. So now, one of the exciting parts, or not exciting because it's trick or treat light, not trick or treat full. Do we have Dr. Rita Nguyen here?
Yes, I'm just going to share my screen. And thank you, Jeffrey, for tempering expectations because I will almost certainly disappoint. Can folks see my screen?
Yes.
Okay, great, thanks. So I just want to start off by saying I personally, and I know DPH, just takes no personal joy in being the Grinch for any of what's happening around COVID. We don't mean to take away your dining, your picnics, your Halloween, but our main objective is to keep the community safe and to equip the community with the knowledge to make the decisions on what risks you're willing to take. And this applies even for everything that's open now. And so that's sort of how I'm going to couch this presentation, that again, none of us want to be the police of fun, and we have all been put into the position of that in the name of keeping the community safe. And just to let you know, I have 2 small young children. My son's favorite holiday, or honestly favorite day of the year, is Halloween, even more so than birthday or Christmas. So I certainly have a lot of empathy for those of you who feel like you have to make modifications for the way that you're celebrating. We won't be celebrating Halloween this year, but when I think about it, I much rather have him not be trick-or-treating than accidentally expose somebody at their door and make that person sick, who makes somebody else sick, who makes somebody else sick, and then ultimately somebody's mom or grandma or sister dies. And unfortunately, that's how this pandemic works, that and some, and maybe to most people, are asymptomatic from COVID-19, so you can't know that they're sick, and you don't know what interaction might lead to somebody else getting sick. A lot of folks who are in younger ages feel like they are invincible and they'll just have a cold, but it's not about them. It's about everyone else they're connected to, and then ultimately somebody in someone else's neighborhood is dying because of it. And so I keep that in mind with all the things that I am restricting my family from doing. But I also recognize everyone's circumstances are different. So I will go over what is technically prohibited by the state even, what's permitted, and then also ideas of how we can celebrate more safely. Happy to take questions as well. So unfortunately, I have to start with this because in some respects, it's easy to be black and white. Some of this isn't even up to San Francisco. So the state actually bans gatherings. And so just to remind everyone, indoor gatherings for anyone outside your household is prohibited in any circumstances, currently in San Francisco, Halloween or not. The exceptions are for worship, of which indoor worship was allowed as of a couple weeks ago. And so for in the context of Halloween parties and events, I'll speak to this a little bit later, but indoor risk is extremely high compared to outdoor. We're finding out more and more in the science of just how risky it is to be in any indoor setting with people that aren't related to you. Just this Monday, the CDC finally came out and said that this is an airborne disease and that the virus actually spreads more than 6 feet. It's worse when you're in indoor settings where the virus can just collect. And so it's something we want the public to know whenever they do choose to engage in anything that's indoor, even things that are allowed. It's not that we're saying indoor things that are open are safe. We've tried to make them safer, and all we can do is equip the public with information so that they can make their own decisions, because we all know you're adults. You do make your decisions on behalf of your kids. We just want everyone to have the right information. And so relaying this to you. Outdoor gatherings are permitted in San Francisco with up to 12 people who are outside your household. But when you do gather, it's safe. You still would maintain 6 feet distance and have a face covering on. So along those lines, it's also prohibited haunted houses, carnivals, festivals, and so forth. Discouraged activities, unfortunately, we did have to come out to say that trick-or-treating or trunk-or-treating, which is when people do this with their cars, is discouraged. If you are going to do it, then consider preparing goodie bags and laying them out at the end of your driveway. I know some folks think that what harm could it do to have a kid in front of them for 5 seconds at a time? But you have to think about sort of the cumulative risk of all the different households that are breathing on you and in your space, and how quickly is that air right in front of your door really being circulated. And we mentioned goodie bags because the sharing of food is higher risk than the sharing of objects. As you can imagine, if the outside of a candy bar is contaminated because someone sneezed or coughed or at some point in their hand and then touched the thing, someone opened it and then ate it, that's a quicker mode of transmission than if it's an object that people aren't putting into their mouths. Traveling to a rural festival is also discouraged because the more people travel and simply put share germs, the more the virus can spread. So some safer ways to celebrate Halloween, certainly anything in your home is fair game. Your household members are considered, folks that you live with and presumably have had a lot of contact with. So pretty much anything you want to do in your home is great, except for inviting other people into your home who don't normally live with you. And so any number of activities. And I suppose the most public health oriented one is making homemade pumpkin spice hand sanitizer, but I suspect many of you may not pursue that. But these are home activities that would be fine. So again, outdoors is much safer than indoors, so much so that we wrote a whole document about why indoor risk is so high. And so you can quickly visit that by going to this link. It's just our main website, sfcdcp.org/indoor risk. Some studies actually quote that it is up to 18 times more risky from a COVID perspective to be indoors. You can spend time with up to 12 people outside your household outdoors, again, while maintaining 6 feet physical distance and staying masked. If food is involved, then actually the maximum is 6, and that's at all times, not just Halloween. So if you were gonna have a picnic, it should be a picnic of just 6 and rather than 12, because as you imagine, you have to remove your mask while you're eating or drinking, and that just exposes people around you to potential virus. Because again, the number of people are asymptomatic when they're sick, so you can't actually know someone is carrying the virus just by looking at them. Other ideas that you could do with up to 12 people outside your household is a scavenger hunt or pumpkin carving. So all the usual things that you might do with other people, but try to keep it to 12, and it would be outdoors. And again, meals would be a max of 6. And so always, in any case, wear a face covering. As I mentioned previously, increasingly, we know that the virus can spread. And the CDC coming out on Monday was no surprise to San Francisco. For months now, we've been following the literature, and we've known how risky airborne transmission can be, and that the virus can travel more than 6 feet. And that's why we've tried to be so clear in messaging that face covering is so critically important. And a reminder that a Halloween mask is not adequate, because many times there's holes, or it doesn't quite cover your nose and mouth and your chin in a fitted manner. Stay outdoors as much as possible, stay 6 feet apart, wash your hands frequently, especially before handling food or items that you plan to share. I acknowledge that we discourage sharing, but we also know that people also share food because they need to. And if you do, then just make sure you're washing your hands before you're handling it and passing off to somebody else. And then minimize the groups that you're mixing with. So less groups of 12. That doesn't mean that you should host multiple parties of 12, because you're just exposing yourself to multiple groups. And in general, we try to advise people to keep small, stable social circles. So rather than hanging out with a different group of people every week, try to be mindful of a smaller group of people that you see more consistently, so that you're not exposing yourself to so many different social circles. And of course, if you're sick, stay home and away from others, and get tested. It's not quite enough to just stay home, because you might actually be sick yourself and have COVID, and you don't want to spread it to your family members. You don't want to spread it to your coworkers. And people who do have COVID are contagious for 10 days at least, or 10 days essentially. And so if you come back after a runny nose for 3 days, you still could be exposing folks. So that's the end of this. I'm happy to take questions. I'm sorry I couldn't have a more fun message for you of all the great things you could do this year, but it's a bit reflective of this entire year. None of us want to be in this. None of us want to be making these sacrifices. And yet here we are.
Thank you, Dr. Nguyen. She's amazing. She writes it and delivers it sweet, even though it's Halloween light. Mike, Mike from Tenderloin Boys and Girls Club.
Yeah, so quick question. So definitely agree with all the guidelines. I was asking about guidelines like 3 weeks ago, so it's great to have, again, we can't stop Halloween, so how do we make it safer? We have had play streets, which is basically a street closure approved by, the city of San Francisco and fire departments, SFMTA, so on and so forth. And it basically allows us extra space for people to be as safe as possible, but enjoy being outside in these very uncertain times. With that being said, our idea for the 31st was actually to do a socially distanced costume contest. My guess is it probably won't be a small group of 12, but within the same token, we have the full block at our disposal. So, it wouldn't be like only a sidewalk of 12 kids walking, it'll be the whole block. And so with that in mind, does it feel like we have enough space in order to do that activity? Or should we rethink what we're doing?
That's such an excellent question. And Michael, can you tell me what group you're affiliated with again?
So I am with the Boys and Girls Club,
Okay.
but part of a greater Tenderloin network of agencies working to kind of, alleviate as much stress as possible for COVID.
This is such a nuanced question that it went to the city attorneys earlier this week. Jeffrey, is it okay if we provide a written answer to this group in an email afterwards? Because I hear your point. There have all the efforts to make safer streets and closing out streets, it essentially becomes a gray area of gathering, because as you're pointing out, this likely will be quite a large gathering, which is prohibited by the state. And forgive me for not knowing whether or not the Boys and Girls Club is technically considered a city-sponsored group, or are you more nonprofit?
Nonprofit.
Yeah. I want to give a more precise answer, so I'm going to ask Jeffrey to send you something in writing, because this is very gray, and it is something we've been discussing with the city attorneys this week. So I want them to give the official response on that.
Okay, and just to give it added context, thanks to Jeffrey and others, we were able to do COVID testing as part of Play Streets 2 weeks ago. 102 tests, 0 positives. So, to a degree, the population that we've been outreaching to specifically in this space has been working really hard to be as safe as possible. And so just want to put that out there as added context.
Great, thank you, much appreciated.
No,
This
and
is
then
Brian for the.
I'm
This is
sorry,
Brian from the
Brian.
coalition. I just want to piggyback on what Michael said, because I want to make sure that we do get this response, this written response, because this is the tenderloin we're talking about. And we have had such crappy luck getting even play streets approved. I mean, compared to Hayes Valley or another neighborhood that just gets whatever slow streets they want, we as usual don't get it in the TL. So this is one of the few gems. I mean, I've been out there. My office is actually right on the block where they do it. And you see Code Tenderloin out there. You see the Tenderloin People's Congress out there. I mean, this is a community gathering that works. It's safe. It's people are spread apart. And people have been really mindful about it. So if we lose it, we really would like to see some sort of written explanation why, because there's not much else that we have.
Great. If you don't mind sending me your emails, I'll also make sure that you get the response. But I think if you're on Jeffrey's list, then I'll be able to get that response to everybody.
Right. Everyone here.
Okay.
And thank you. And then also just, you said 12 people too, like, you know.
12 outdoors.
Yes.
If it's a household that's 14, it's fine if it's your own household. But if it's for people who are not in the same household, the maximum is 12. If food is involved, then it's 6. And that mirrors what happens at outdoor restaurants. So you can't dine with more than 6 people who are outside your household.
So what if it's a residential building and you have a bunch of families out in the, does that change at all? If you've got a family of 6 next door to a family of 8, do they get to hang out in the common area?
That would be 14. So unfortunately, no. They aren't in the same household, even though they live in the same building. A household would be folks who like live in the same living space, share food resources, and so forth.
And I guess what I'm really saying is that, you know, again, what we need is a standard to be able to work from, but also realizing that every situation is to a degree a little different. And so, you know, I gave the context of our testing to kind of just show that, you know, we are working really hard with, you know, hand sanitizers. We're ensuring everyone wearing masks. We're giving out hand sanitizer. We're wiping down any kind of equipment that needs to get used. And so, you know, we've been putting in a lot of effort. Our play streets for the past 3 weeks, which is how many sessions we've had so far, we've literally had between staff and volunteers upwards towards about 30 people to ensure that it's being safe and properly ran. And so I just want to make sure we're doing it correctly.
Right,
and, you know, on path, again, to be as safe as possible.
Right, and then just to point out the rationale behind the difficulty with these types of gatherings and events and trick-or-treating is that it is hard then to actually maintain physical distance. Like what my 6 feet is different from someone else's 6 feet. And the more people you get together, the harder it is to have any type of enforcement or like helping people to stay apart from each other. And so that's part of it. It's like, especially many of the streets in San Francisco that are known to have good trick-or-treating, those sidewalks get very crowded and there's essentially no way that folks can stay 6 feet apart. And that's why the recommendation is that people do not trick-or-treat, because it's hard to do crowd control and hard to maintain that distance and make sure everyone's properly masked. And there's no person out there. We don't want people being policed around trick-or-treating either. So.
Gotcha. And our final question is from Lisa, because we have another presentation that's going to require just as many questions. Is it Liza or Lisa?
Liza.
Sorry,
I was just walking down Larkin Street and also Polk Street, and I'm looking at the outdoor dining, and there on one block, there's over seating for 50 people. So again, I don't understand why there would be hesitation, especially if we have the play streets and we've maintained that and we've shown that, why we can't have a holiday event there when up the block, there's just as many people on that block. And we've been doing it.
It's a great point. That's why it's not so black and white. And I do want to provide a written response to you. We hear your point.
Perfect. And then she'll get that and we'll make sure that everyone gets that information. And our Tenderloin, we have our own group. I think it's Brandon that's over it. You all will get the clarification.
Yeah.
From Dr. Rita Nguyen.
And I also just want to point out, one last thing. I just want to point out that as we open up more sectors and people participate more in activities together, the risk is elevated for everybody. So I get the logical rationale of like, why can they do this and we can't? That's certainly not the space you want to be in. But as you can imagine, it's increasingly anxiety provoking for the community if folks are partaking in all of that. The people who are dining or the people who are going into hotels and gyms. Like, it's just a lot of exposure that's happening. So to the extent possible, we just want to equip people with information on how to stay safe. And it is safer for the community that you not participate in everything all at once in big groups, even if it's allowed. So just be mindful of the things that you choose to do and the impact it has, not just on you and your family, but those in your community, and maybe not even those that you live with. It's ultimately where that virus gets to and who it ends up really hurting. Thanks, Jeffrey.
Thank you so much for delivering us Halloween light. Now we have our food coordination group division of the CCC, that presentation that will be done by Shireen McSpadden. And Shireen has also stated, like, should we go a little over, those that have a question, she will be able to answer, should we go over the 2 o'clock time. So, but her presentation will be finished before the 2 o'clock time, but just wanted to kind of put that heads up on this.
Many people here participate in a 2 p.m. a District 6 office, Matt Haney office meeting.
Yeah.
Meeting.
I'm sorry. I know we went a little over on this time. I just want to say, I'm not saying that it will be over, but it may be over. So the presentation will be completed by 2, just letting you know. Okay. Shireen, you're up.
All right. Thanks, Jeffrey. So hi, everyone. I'm Shireen McSpadden, and I'm the Executive Director of the San Francisco Department of Disability and Aging Services. And also today, well, in general, I've been providing some management liaison work with the food coordination group at the COVID Command Center. And so I was asked to speak today to you to talk about the strategy that that group has been using to really think about food security during COVID across the city. So I do have a little bit of a dense presentation here. I will try to, David, to your point, I'll try to get through it quickly. I'm really happy today to see a number of familiar faces, and I know that there are a number of people here who I also don't know. So I will jump into it. And Jack, I want to thank you in advance for advancing the slides for me. So we can go to the next slide. Sorry, give me a second here. Okay. So in response, and you know, I know a lot of people were concerned about the name of the what was now calling the Food Coordination Group at the COVID Command Center. I think that there are a number of people who've been trained in incident command, and the terms that we use nationally in incident command and the terms that we use locally should definitely be different, because we need to be responsive rather to community needs and concerns. And so now that group is calling itself the COVID Food Coordination Group of the COVID Command Center. The mission of the group is really to coordinate food resources, so to support food security of San Franciscans, especially those impacted by COVID-19. We're really fortunate in San Francisco to have a robust network of community resources that support thousands of people each year through meal and grocery programs around the city. Many of you are involved with those in various ways. We've worked to support the sustainability of the system and build capacity to quickly scale up the food resources. So the work is structured in 3 main functions. It's really to support the city's food system to align with COVID-19 containment and mitigation strategies. So for people who need to stay at home, shelter in place, focus on them. And then, you know, really to kind of help people, especially people who are vulnerable to COVID, to not have to go out and seek food. It's leveraging existing food resources and their infrastructure as the bedrock of mass food support strategy. And it's developing new food resources to address the unique needs of high-risk populations and neighborhood populations. So next slide. Sorry, I'm trying to get my view here correctly. So the COVID Food Coordination Group is located within the COVID Command Center Human Services Branch. And its primary responsibilities are to support the communication and coordination between city and community partners to develop San Francisco's food response to the COVID-19 emergency. And that means sustaining existing network upon which thousands depend, identifying opportunities to expand capacity, and flagging needs, kind of sending those needs up through the chain of command at the center. It's managing meal resources and services at the alternative housing sites in coordination with the CCC housing group. It's communicating community needs to HSA and CCC leadership to support funding and resource decisions. And then under Incident Command Services and Emergency Response Protocol, responsibility for mass care and food support falls under the San Francisco Human Services Agency. And this means the COVID-19 food response budget is also held by the Human Services Agency. And then another responsibility of this group is to operationalize food response, including management of many of the contracts for the COVID-19 food response in collaboration with Human Services. And next slide, Jack. So the CCC Food Coordination Group accomplishments, these are things that the group has been working on since March. They established the Isolation Quarantine Food Helpline, created public-facing resources for community members, also created a fleet of disaster service worker drivers to deliver meals and groceries. They've supported food providers to stay in operation and expand services through coordination of PPE, deployment of service workers and other resources. They worked with community to form a food support task force that's still meeting weekly. They launched a public reporting page on the city's food response with support from the Joint Information Center. And then they've secured $8 million actually more than $8 million at this point. It's more like $10 million in private funding, and administered $7 million in Give to Us funds, primarily for community-based efforts. So of those private funds secured, there's been about close to $2 million distributed by the San Francisco African American Faith-Based Coalition, about 1.6 million for Mother Brown's. I think Gwen is on here, for Mother Brown's great work in Baby Hunters Point. 1.3 million for the San Francisco Produce Market, and then 600K for Kana and the Mission Food Hub, and 270,000 for meals to SR residents via La Cocina. So lots of community support and involvement there. Next slide. So the COVID food response, a funding strategy. Just in the next slide. So overview of the COVID-19 food response funding. The total city funding for the COVID response is approximately 55.3 million. Most of this is from the city budget, which is about 48.4 million. And to break that down a little bit more, it's close to 46 million that the mayor put into her budget, and then $1 million in the Board of Supervisors add back process. And then there's some other one-time only spending from the Department of Disability and Aging Services, where we were able to allocate some dollars. So the city funding supports the citywide response. And given that funds are, even though it sounds like a lot of money, it's actually fairly limited once you start thinking about the food insecurity across the city right now. So given the funds are limited, the unit really tried to strike a balance between support for general public and populations facing heightened risks due to medical vulnerability, and to build strong foundation and develop a broadly accessible system. So that means really thinking about mass food support, resources for all residents experiencing food insecurity. That's things like food pantries, and then specialized supports for high-risk populations. And then the Give to SF, which is also basically administered through the city. It was donated funds, and they definitely have more flexibility and are not as mixed with federal and state dollars. So generally much more flexible. We don't have to go through competitive bid processes for those and things like that. So these funds have really been used to support the dynamic services that address emerging needs and resources tailored to specific populations. And again, those are a lot of the things that are being done in specific communities in neighborhoods across San Francisco. For example, these funds have been used to provide food for low-income families, Black and Brown mothers, LGBTQ communities of color, and those are just examples. Next slide. So next slide is the city funding for COVID-19 food support. And this is just a graphic of some of the things that have been done with the 48.4 million in the city budget. And as you can see, it's done a lot of different things: grocery bags, meals for seniors, meals for unsheltered residents across the city and encampments, and then households in isolation and quarantine. And then the next slide kind of shows a breakdown of how the city dollars have been, well, how the city budget dollars have been spent. So again, it's just a different way of looking at that same thing. And I'll go into a little bit more detail about those dollars in a few minutes. So next slide is the Give to SF allocation for food security. And again, it's a graphic. And as you can see, I'm not going to go into each of these, but you can see in the slide how those dollars have been allocated. And so really the idea behind that was to use the funds in a variety of fashions, including gift cards for people to purchase food, as well as distribution of groceries and meals. And so allocations were made based on proposals that came in and requests to both HSA and directly to the COVID Food Coordination Group, with the priority that they were for those with immediate food needs, population facing high risks related to COVID-19 and facing inequity challenges. For example, undocumented and immigrant households and ineligible for CalFresh, low-income families with young children. And again, those are just examples. And then things that were feasible with a 5% Give to SF admin cap, because that was something that was required when Give to SF was created. And part of that was so that these dollars really would go to food and not to support staffing and things like that. And currently, all of the funds that have come in so far are allocated. There are many initiatives that are still active and ongoing, but the funds have been expended for Give to SF at this point. And then here, next slide, Jack, sorry. You can see Give to SF allocation for food security. This is page 1 of 2. These are some of the organizations that are using these funds. And then we'll go to the next one. Okay, and then I will move on since I see that we have very short time left. And then some additional information. If you go to the next slide that says mass food support, grocery programs. So the mass food support strategy is really to provide groceries to anyone in need of food support via walk-up and drive-through pantries. As I think people know, San Francisco Marin Food Bank is the regional food bank. And in this role, they have access to millions of pounds of donated produce and free federal food commodities through their role. Last year, they leveraged approximately $30 million in free federal food. So part of the reason that we support that system is because we leverage so many millions and millions of dollars and millions of pounds of food in and bring those into the city. And it's obviously generic food, so it doesn't address specific needs of communities that have cultural needs that go beyond that, but it does bring in, lots and lots of food that we can't draw down any other way. So basic food includes protein and produce, and grains, and also includes shelf-stable items and milk when they have them available. And then these are just additional notes. Also wanted to point out that the mayor recently made a pretty big commitment to the Latinx community and committed $28.5 million in her budget. And there's about $4.2 million in the city budget that kind of goes to offset some of these dollars from the food bank, specifically because the Latinx community has been hit incredibly hard by COVID and has about 50% of the contagion rate. And so the mayor really wanted to focus on that community. We have about $4.2 million in the city budget that's dedicated to the Latinx community, and an additional close to 800,000 in gift to 800,000 in gift to SF. So that's about $5 million total. And that money is still being allocated. Some of it has been allocated to community organizations, but we have to go through a competitive bid process to get the rest of it out the door. And then the next slide just kind of shows where the pop-up pantries are. And I can also send those out. And then the next slide is aging and disability supports. There are a couple different ways that we support older adults to access food while sheltering in place. One is Great Plates, which I'm mentioning really because it's a program that was developed by the governor, and it only supports, it doesn't support everybody. It doesn't support people who are on who say they're on CalFresh or who are receiving other programs, are on other programs that are provided by the Department of Disability and Aging Services. And so it was hugely controversial on many levels. And I was one of the people that really fought to broaden it at the state level. In my state leadership role, I tried very hard to get it to be more broad. On the other hand, it has served about 2,900 people in San Francisco, and it is supporting a lot of restaurants that are run by communities of color. About 80% of the restaurants for this program are communities of color. So it's a program that kind of leverages really actually supports small businesses and small restaurants to provide food for older adults. I can't say it was well conceived, but it is a program that the city decided to take on because it supports restaurants, and it is serving about 2,900 people. And then the rest of the Aging and Disability Nutrition Network, we have about 12 community-based providers that provide ongoing meal and grocery resources to older and disabled community members. We have the large-scale operations that people probably know about, like Meals on Wheels, Project Open Hand, but we also have a number of organizations that provide nutrition in communities. Organizations like Self-Help for the Elderly, Bayview Senior Services, Kimochi, Central Latino, 30th Street, Russian American Community Services, and we've, as a department, have put a lot of extra money into those organizations to ensure that we are supporting communities of color and neighborhoods across the city. And so now I'm talking right now this is really the Department of Disability and Aging, and it's my role there. And then I just wanted to say that the 45.6 million or 46 million that the city has put in is not just local general fund, it's really leverage dollars. So what it is, it's money that that the COVID Command Center and the Disability and Aging Services Department have been allocated by the mayor's office to spend, but a number of those dollars are not local. They're actually dollars that we expect to get back from FEMA or to get back from other reimbursement programs at the state and federal level. So part of the reason that we have to go with some of these bigger organizations, such as the food bank, or part of the reason that we decided ultimately as a city to use a program like the Great Plates program, is because of the incredible leveraged dollars from federal and state sources. And so it gets a little complicated with the budget, and the dollars that we have locally to spend are a lot less if we're looking at some of the smaller programs. And so the biggest, I think one of the ongoing commitments of this group and of me, and also the mayor's office, is to really think about how we now we're turning to philanthropy. The mayor's chief of staff and I have had several meetings in the past few weeks, and we have another one set up next week with a group of philanthropists to talk about some of the great work that a lot of you are doing in the community, and to really start thinking about how we leverage the role of philanthropy in continuing to support the really important work that's done in communities. I mean, I know that you're reaching people in ways that some of these bigger organizations cannot, and we know that we need to continue to work as a city to bring in extra dollars to support that work, since unfortunately hunger and food insecurity are not going to go away. So when I think about the work that is being done in the Tenderloin, in Bayview, in OMI, in the Mission, in the Chinese community, I mean, all of that is so important. And I personally am really committed, but I know the mayor is really committed to continuing to figure out how we bring more dollars in for the great work you're doing. So that's my report. And I'm happy to answer any questions, and some may have come in through the chat that I haven't been able to look at yet.
Yeah, I'm gonna let Veronica Shepard, she had posed several questions, so Veronica.
Sure. Hey, Veronica.
Hey, you guys. Sorry, I'm out here at 90 Kiska at our mobile testing site. Woo! We all here. Grocery people are getting tested. Just a couple of questions about.
Veronica, you gotta get a good spot. We can't hear you that good. Wherever you stand.
Can you hear me better now?
Move back where you were.
How about now? Is this better? Move back.
Don't move.
How about this? Is this better?
That's good.
Don't move.
Yeah,
okay.
Don't move.
Yeah, because of where I'm at. Okay. How do we continue to leverage funds for so many of our families out here that don't meet the eligibility requirements of Great Plates, but still need the resources? I know, and I do understand how it was, driven and how our city had to take it on. But I know some of the data, Shireen, and the people I know who need it the most that are food insecure can't meet the eligibility requirements because they live in multi-generational households, they are on CalFresh, etc. What can we do to offset? Because they truly need that resource, but it's just not available. And I don't want to encourage people to lie just to get a resource. So
well,
your insights.
Yeah, so that's only one program. And that's what I'm trying to say is it's only one program. In terms of, since that program is specifically for older adults, we have a number of other programs for older adults being run by a lot of the community organizations that I just mentioned. Mm-hmm. And if we're not reaching those communities through those other programs, then we need to talk about that. I mean, that's specifically the role of my department. And we spend a lot of time in community thinking about the best way to support communities, older adults in particular. So, as I mentioned, I think when we talked about this a while back, that we're happy to hear from you about what the best way to reach those people who are not accessing programs are, and we can figure it out. But we do have a number of other, but Great Plates is temporary. It's short term. Any month now, I expect it to not happen anymore. So, but that's a very small program compared to the number of dollars that as a department we have going out to seniors in the city. So let's continue to talk, Veronica.
Okay, thanks so much, Shireen. Thank you.
Sure. Thank you. Thanks for your work.
I know I see several members of our Asian community. I know This is a question. Do anybody want to kind of talk since we have Shireen here? All right.
Sounds like we're running into the 2 o'clock or past
Yeah.
the 2 o'clock time, huh?
Yeah, the Tenderloin, but I know I had Chinatown leaders on here. So anybody questions before Shireen leaves? It would be great. Would know going, gone.
Well,
So thank.
Miss Karen, no question.
Okay.
Thank you, Shireen. It was thorough. I think everybody got answers to most of their questions, which is really important.
Thanks, Karen. Long time no see, Karen.
Right.
Thank you.
Thanks, Karen. Thanks. Okay, here it goes again, like an auction. Going, gone. Thank you all. Sorry that we went over. To Miss Gwen, do you want to talk? Okay, 2:07. I apologize. And thank you, Shireen, so much for coming out. So much. Shireen is amazing, and I actually got to see her amazingness this week. So thank you all.
Hey, thanks everyone. Take care.
And this concludes our meeting. Thank you for joining the COVID-19 learning community. If you have any questions or needs, please contact equity-neighborhoods@sfgov.org. And with the long weekend, please stay safe and thank you.